Hello there, my name is Amamas and I'm a presenter from the group 1 and 2. And today we're going to talk about background on genetic testing. Genetic disorders. So genetic disorders are disease caused in whole or in part by change in DNA sequence away from the normal sequence. Genetic disorder may be due to mutation in one or multiple genes, a combination of gene mutation and environmental factors, and damage to the chromosome. So there is a few examples of genetic disorders such as Down syndrome, polycystic kidney disease, Cadu-Cat syndrome, albinism, Fragile X syndrome, fibrosis, cystic fibrosis, Klinefelter syndrome, hemophilia, Marfan, thalassemia, bone marrow disease, Huntington disease, Angelman syndrome, and Ehlers-Danlos syndrome.
Hello, my name is Siti Madiha and I will continue this presentation and I will talk about how can genetic disease can be prevented. So the first one is about avoiding harmful environmental factors which increase the mutation frequency. We must avoid radiation exposure, especially during the reproductive period. Radiation exposures of humans are traditionally expressed as expected increases in the frequency of genetic diseases. The second one, screening all newborn infants for disease when early treatment can prevent the occurrence of physical and mental handicaps. The most outspoken example is phenylketonuria, which is PKU, where screening and early treatment have been of great benefit. The third one about early detection of couples at risk, followed by genetic counseling and preventative measures in case of subsequent pregnancy. Vast majority of genetic diseases cannot be treated, and in these instances efforts can be concentrated only towards the prevention of the birth of affected children. The most effective way would be the identification of heterozygous carriers before reproduction, followed by genetic counseling. The last one is control of teratogen. Teratogenic disorders occur when the baby is exposed to substances during pregnancy that cause abnormalities, otherwise known as teratogen. Babies are very sensitive in the first trimester, when all of the organs are developing. Teratogens include alcohol, drugs, lead, high levels of radiation exposure, and certain medication, infection, and toxic substances. Okay, the next one is genetic test. What is genetic testing? It is a test that identifies changes in chromosome, genes, or protein. Genetic test can help determine a person's chance of developing or passing on a genetic disorder. It also can confirm or rule out a suspected genetic condition. Principles of genetic test. Samples of blood, hair, skin, amniotic fluid, or other tissue are collected and sent to a laboratory for genetic testing. For example, sample of cells from the inside surface of the cheek is being collected by small brush or cotton swab. Then the sample will be sent to a laboratory to undergo genetic testing. Various methods are available for use which include molecular genetic tests. It is to identify variation or mutation that lead to a genetic disorder. The next one is chromosomal genetic test. It is to look for extra copy of chromosome that can cause genetic condition. The last one is biochemical genetic test. It is to identify abnormalities of protein that result in a genetic disorder. Okay, so what is the purpose of genetic testing? We know that each type of genetic testing serves its own distinctive function. However, genetic testing is carried out generally to screen unit for a genetic disease, find a genetic disease prenatally. It is used to detect whether an in utero fetus possesses genetic abnormalities, usually carried out if the parents are carriers of mutated allele. Some example of diseases in which this method is applied are beta thalassemia, cystic fibrosis, and Tay-Sachs disease. Early detection allows for proper planning for future therapies such as blood transfusion or gene therapy. The next one, find out if parents carry a genetic mutation which could be passed on to their future children. This is so significant for partners to make their proper reproductive decisions. The next one is confirm the diagnosis in symptomatic patient. In symptomatic patient, the patient could be present signs and symptoms such as fever, nausea, vomiting, severe headache, stiff neck, severe muscle pain, and many more. The last one is to determine the best dose or type of medicine to be given to a patient based on their genetic findings. This is all the references we use to make this presentation. Okay, that's all from Group 1 and Group 2. Thank you.